It's your chance to ask anything of the doctors tonight on Call. Funding for On Call television is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call television as it continues to open doors for important medical information. And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding is provided by Dakota Care, Brookings Health System, Dr. Mark Bubach with Dakota Allergy and Asthma, Dakota Dermatology, Aberdeen Asthma and Allergy, the Orthopedic Institute, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation. It is time to let you at home pilot our show. Call in your questions on whatever health topic you want, because it is Ask Anything when the doctors are on call tonight.
Hello and welcome to On Call Television. Ask Anything. It's one of our most popular topics, the show where we look at the big picture. We discuss any topic you're interested in or curious about. We go where you want us to go. It is your opportunity to stump the experts, to test us, to see how deep our knowledge about your particular malady is. We have invited in experts whose training and experience is about the whole person, from the head to the toe, see all they know. There are no bad questions, and when you make the decision to pick up the phone or email a question, it may truly help you or someone else out there with the same concern. And thank you to all who have called in with questions before. It helps. Do it again. It's my great pleasure to have three experts in general medicine and family practice as my guests tonight. So, Jill, tell us a little bit about you. Jill Kruse, Doctor of Osteopathy.
Yes, so I'm the newest member of Avera Medical Group here in Brookings. I've been here for about the last 6 months. Prior to that, I was practicing rural medicine in Tyndall, South Dakota, and was there shortly after I finished my training with the University of Wisconsin in Madison and Baraboo with their rural training program.
All right.
So, local girl. I'm from Inwood, Iowa originally. Went to Augustana for undergrad and did my graduate studies here in micro at South Dakota State.
We've got two Augies, and then you've got a SDSU.
So I have both.
You're covered in both. Well, great, and it's been nice having you as a partner for 6 months. It's been a good experience. I've got you on the camera, but I mean, I've sensed that you've enjoyed this.
Yes, it's been a very good place. I have two small children who love the Children's Museum, so it's been great to visit it weekly.
Yeah, that's great. Well, and Andrew Ellsworth, who is also a local guy, a new Brookings, what do we call ourselves? The Avera Group Brookings. So where are you from originally, Andrew?
I'm originally from Madison and went to Augustana for undergrad and then University of South Dakota for medical school. And then I decided I'd need to go somewhere else for a few years, so I went out to Idaho and got my training out there in family medicine. That was a nice big spectrum of everything and procedures and patients, and got to do a little bit of skiing and other stuff on the side too. And then after residency, wanted to come back to South Dakota, where my wife is from Laverne and I'm from Madison, and we thought Brookings would be a great fit, and we've loved it. Been here a year and a half now.
Year and a half. Think you stay?
Yeah.
And now you have two children.
Yep, I have a 4-year-old boy and a little baby girl. She's 9 months today.
And I have to tell you that we have a hospice singing group. Well, it's not just hospice, it's for people in need. And it has been a joy to have your fabulous voice join us, and your wife's fabulous voice. And then the 4-year-old also sings periodically.
Eli tends to play, but he'll probably sing at some point.
We appreciate it. It's a great honor to have the two of you here today. And I think they're going to answer any question you can throw at them. But we also have a third guest, not quite here with us yet. We have Dr. Mitchell Penn, who is a family medicine physician in the British Virgin Islands. And we met them down there, his wife, lovely wife, Faye, and Mitchell, just this last December, and said, how about being on the show? It'll be a different perspective. Maybe we'll get a little bit of the view of what life is like practicing medicine in the Virgin Islands. So, well, but he'll join us in the second half of our show. We've got a question. I think we'll take the first man on the street question. We have several of those.
One of the questions I guess I would have would be is I feel like I'm losing my memory here in middle age. I'm 55 years old, and feels like I struggle remembering names and being able to recall them, although it seems like I can do complex things at work. What would be an answer for that?
All right, guests, what do you think about that?
Yeah, you know, struggling with names and stuff like that can be pretty common concern and complaint, and a lot of times it doesn't mean you're getting Alzheimer's. It's just sometimes part of being alive, that you don't remember everything. I think when it gets more concerning is if you start forgetting things that you really shouldn't forget, like you're driving home from work and you get lost. That can be a warning sign that that you might want to get evaluated.
Any thoughts, Jill?
Definitely with being stressed, not having enough sleep, all those things can challenge your brain, and if you're not on top of things, it's easy to forget. I'm terrible with names. It helps me not divulge any patient information because I can't remember their name as soon as I walk out the door, so it's probably a safety measure for me not to spread any medical information about patients. So, you know, names are hard, but if you try to make a little trick or a mnemonic to remember them, and find something that you can trigger with either like their face, or you remember that they wear glasses, and then find something that stands out or something you can link it to, that makes it easier to remember names.
I think exercising your brain is really important too. Mm-hmm. You know, it's kind of use it or lose it, and if you don't engage your mind or just sit there and watch the TV, and instead interact with the TV and call in questions or something.
Yeah,
you know.
there you go. Call in the question. I do know that there is probably no better puzzle, brain exercise, and this has been tested, than a conversation. And so, you know, interacting with other people, having a conversation is important. I do think that if a person is in their middle age and they are not remembering names quite as well, it might be that they're just not concentrating on names. They say that as you get older, you concentrate on different things. But there are some things that you'd want to rule out or work up. When is the time that you would do a workup, and what workup would you do?
Yes, I would start looking, are they doing things like all of a sudden you can't find your keys because they're in the fridge? If you're just making mistakes that shouldn't happen, I mean, leaving your keys in your coat pocket and forgetting where they are is very different than putting the keys somewhere they don't belong. Wandering and, like you're saying, not making it home or missing a turn of something that you know that you should be able to do. Having a hard time keeping track of finances if there's problems with bills and things being lost. Those are all things that I would get checked out. I know with my grandmother, that was one of the issues of, all of a sudden there's a stack of overdue bills on the table. What do you do? Oh, well, she's having a hard time not remembering which bills she paid, right. And that's when we needed to step in and have her evaluated.
Go ahead.
I was just going to say, yeah, I mean, life can start to get overwhelming for whatever reason, and organization is always helpful. So, writing things down, giving yourself reminders, as far as medications, getting a pill box, so you can know if you've taken it or not.
And almost uniformly, the people who I see that have true memory issues are people who aren't asking me. It's their family members. The people who get that are commonly cover-uppers and cover it up. And so when they come to me and go, I'm worried about my memory, generally they're fine. They have enough wherewithal to do it. I would think a B12 and a thyroid test, and if it gets bad enough, a CAT scan, and that's about it of the brain. Is there anything more that we should be doing?
The mini mental status exam is a very easy thing to do. It's a series of 20 questions.
Yeah, adds up 30 points.
Adds up to 30 points.
So the cutoff is at 20.
It looks at recall and concentration and your ability to remember something and repeat it.
That antegrade, learn a new thing.
Right.
All right. It seems that Dr. Penn was able to break away from his meeting, or it finished early, and we were going to be able to have him join us. Are you on the line there, Mitchell?
Yes, pleasant good evening. Pleasant Virgin Islands evening to everyone.
Yes. Thank you for joining us and for that Virgin Island welcome. We were talking about Alzheimer's disease or memory loss. Do you have anything that you'd like to add about that, Mitchell?
I think that one of the very important things is the diagnosis of Alzheimer's, the diagnostic criteria that one would use for determining Alzheimer's. It's quite important that persons are not mislabeled as Alzheimer's versus just senile dementia.
Yes.
And, just remembering that Alzheimer's as a diagnosis is one that is made quite later on, rather than quite earlier. Is a pathological diagnosis really. So in terms of managing patients, it's a challenge in determining who has Alzheimer's versus who has senile dementia. Persons with multiple strokes, for example, may actually present as Alzheimer's patients when in fact what they have is actually stroke disease. And it's quite important, I believe.
Well, and I would add, if, like you say, multi-infarct or tiny little strokes can be due to, for example, a valve abnormality in the heart or an infection on the valve or carotid arteries. And so a consideration, particularly if there's on your exam some sign of a focal neurologic thing to do those workups.
And from the history, if it's a stepwise decline, an infarct and decline, that you don't realize it was infarct because it's just microvascular, but as opposed to a long gradual one, if it's more stepwise, that could be concerning for.
And the treatment, of course, is make sure that they have everything you can do to prevent vascular disease. Your blood pressure's controlled, the metabolic status is good, they don't have sleep apnea, and so on.
Another thing that can mimic Alzheimer's or dementia is normal pressure hydrocephalus, where there's increased swelling in the ventricles of the brain, and that can cause slow speech, shuffling gait, memory loss, problems with incontinence, and a lot of these people end up mistakenly labeled, put in a nursing home for something that's very treatable and reversed.
Well, yes. Although I've been so frustrated in my lifetime of experience that it's hard to find the case where it's treatable and you can catch it and reverse it. I mean, I've been there. I've watched for it, and when you have just exactly that picture, you can put a little drain in the brain and take the pressure off and hopefully reverse it. I've had one case, I thought, that really did work. We've got questions from out there. From Minnesota, can a 16-year-old boy who drinks energy drinks become addicted to other sugar products or addicted to those drinks? What's your take on energy drinks?
Well, so the biggest concern with the energy drinks are the caffeine and I guess the sugar. But you could be drinking tons of pop and you're getting all the sugar, but the caffeine is what can be dangerous with it. That's what's keeping you awake to do your job or do whatever you're trying to do, whether it's play video games or what. But it can take a toll on the body.
Is there anything else in those energy drinks, though? I mean, do they put other...
Oh, who knows? Yeah.
Hard to say. I mean, and then you can definitely get the withdrawal, the caffeine withdrawal, if you're not having the same amount every day. If you're using it to study for a test and then all of a sudden it's the weekend and you don't take them anymore, you can have very bad hands.
In residency, I had a young man in his 20s that he comes in, his heart rate was in the 190s. He was not doing well, and it was really from too many energy drinks, and it took a toll on his heart.
Yeah. Mitchell, have you had an experience with energy drinks down there?
What is interesting is that the combination of energy drinks and the extreme heat that we have in the Caribbean plays a particular role and a toll on person's cardiovascular system, as mentioned earlier. And you tend to find most persons coming in and presenting with, palpitations that they believe they have no idea where these palpitations are coming from. But you stop the energy drinks and it just simply settles down on its own.
Great. I have a call from Sioux Falls. Caller wants you to discuss patients who withhold information from their doctors. Is it a big problem? Jill?
Definitely a problem. Sometimes it's the history that we get will lead us down a certain diagnosis path. So if we don't have all the information, that all of a sudden can change which path down the decision tree that we go down. So if we don't have all the information, it's hard to make a good diagnosis. It's only as good as the information that comes in.
Yeah. Anything else, Andrew?
I mean, if you're withholding information from your physician, I mean, we may still figure it out, but there's, we may not. I mean,
it's tying our hands behind our back. Mm-hmm. That is a wife that's calling because her husband is a classic South Dakotan who doesn't give the whole story because you don't want to be a complainer, because that's what guys do, we don't complain. But when you go into the doctor's office, you need to complain. We need to hear all of the things, and that's the only way we can make that diagnosis.
Yeah, because I don't know what the patient is feeling. Only they can tell me that. So I have to rely on them to give me a good history. Patients will come in and say, "What's wrong with me, doc?" Well, I don't know. You have to tell me. You're the only one who can tell me what's wrong with you, and then I can use my training and information and lab tests to come up with a treatment plan.
Right.
Interesting point with that. Sometimes it's not even that the patient isn't aware that they're withholding information. Maybe they're in denial. An example, I guess even last week, I had a 17-year-old that should be healthy, but he had a lot of odd things going on. And after doing some lab work, I was concerned about cancer. And so, in a 17-year-old boy, one of the options is testicular cancer. And so I asked him, any lumps or bumps down there? And he said, no. I was like, well, let's do an exam. And sure enough, he had a grapefruit-sized testicle that was hard.
Absolutely denying it.
Yeah.
Wow, you saved his life.
Well, it's been growing for 4 months, and so now now he's getting treatment, and hopefully he'll make it through. And there's a good chance he will make it through.
Yeah.
But and so that's why when you come to the doctor, and we're even for physicals for children, checking for hernias or checking down there or whatever else, it's because sometimes we can help spot things and catch them early.
Right. Mitchell, of course, the people in the BVI, those guys are always out forward front with the truth, right? Or are they kind of like South Dakota guys?
All men are same, I believe. Now, one of the important things is that I won't put all the pressure on the patients. Sometimes the pressure of seeing so many patients per day, we don't give enough open-ended questions, allowing really for persons to warm up to the examination and the evaluation. And so we miss things just because of the pressures of the day. So the relationship with the patients really does help in getting the truth out. Even if they didn't tell you on that exam, they may send you an email after and say, "Doc, I forgot to tell you this." And you can kind of put things together later on.
That's so important. I have to say that if I were going to say that my most important therapeutic modality is a friendship with the patient, because if they trust you, then they'll tell you. If they know that you're on their side, then there is that important relationship. There's nothing more important to me. And as a guy who's been practicing, for a number of years, I have to say that I think it's the most important, not only diagnostic clue that I have, that relationship is good, but it's a therapeutic clue.
Rick, for only being in practice for a year and a half, I'm already thoroughly enjoying my patient relationships. I can only imagine after a few more years.
Yeah, and so that's something that you'll realize is something else. Have you tried to lose weight? Which method did you use? Diet or exercise? Just diet? Were you successful? We sat down with two people who drastically changed their lifestyle to lose weight and get healthy.
We were doing some research online in some of the journals on the effects of sugar and the dramatic increase in diabetes, and we figured we were prime candidates for it. We don't have it now. And other things connected with women's health and weight and obesity. And then I looked online, I found out that I was in the category called morbidly obese, which wasn't pleasant, the body mass index. And so we decided we needed to make a change, and we talked about how to do it. We had looked at books in the past and programs, and we decided we wanted to do something which we could do together. It's more diet than exercise. We're trying to get into the exercise, but we're quite far behind.
That's a work in progress.
Yeah. We used to have a glass of wine with dinner all the time, but now we'll have 1 or 2 a week, only 4 ounces. And desserts are not cakes and things, but like those Bing cherries with the stems. Those are 4 calories apiece, so maybe 5 of those would be a dessert. And we write everything down and look it up. There's a book that she has that's a calorie counter that we're generally around 600 to 800 calories a day.
It wasn't that we had a lot of fast food. We didn't have, we have no junk food in the house most of the time. We have no pre-prepared food. I've always cooked everything, and we've always started off with really good ingredients that we were just a little bit lax in portion sizes and things like that. And so it didn't take a tremendous adjustment in eating different things. We eat the same things that we ate before. We just eat smaller amounts of everything.
She makes all kinds of beef dishes that the gravy, you could throw the meat away. The gravy is so phenomenal, and I could eat 2 loaves of French bread with that. And so we don't do that anymore. And we eat primarily chicken or vegetarian dishes.
One of the nice things is that there are lots of recipes with that use chicken or beef, but you can eliminate the chicken or the beef and put in extra vegetables, and you have reduced the calories, and you have a meal that does not leave you feeling like you need to go get something else.
Some dried red chilies.
You know, maybe a couple of times a month we'll pick up a piece of meat, and then I will use it for a stir fry or something. And one of the things that we've always done a lot of ethnic cooking, but I've done much more, because one of the things that I found out that I guess we kind of always knew is that if you have foods that are really, really flavorful and really spicy, and if you had a wide variety of things, you don't really feel like you're missing anything.
I've lost about 59 pounds, and as of a couple weeks ago.
Mm-hmm. And I've lost about 30.
And we stay under 1,000 calories a day.
I think we filmed that about 4 or 5 months ago, and I just saw them in the office the other day. They have continued to lose, and she's catching up with him. They have increased their exercise now on a regular basis. They think they may raise that calorie count to 1,200 one of these days. And they're just, the fact that they do it together, they're meticulous about it, it works for them. And I so much appreciate their being willing to be filmed and to share their story. Call in your questions and help direct the show tonight. Our number is 1-888-376-6225, or email us at questions@oncalltelevision.com. We need your questions. We've got some great questions already in the can, but you know what? How about the next question where a guy talked about snoring? A man on the street. And he's looking for it.
My wife says that I snore badly and that I stop breathing once in a while. Should I be concerned about that?
Andrew, he snores, he stops breathing every once in a while. What's the clue?
stopping breathing at night is a big warning sign, and so that sounds like sleep apnea. And the nice thing is sleep apnea is easily treated with the CPAP machine that helps give you more air at night. The scary part is that at night when you stop breathing, your airway gets occluded, your oxygen level's dropping down, in the 80s, maybe even lower in the 70s, and then so your body can't recover, and so you spend the day more tired, more fatigued, and you get sick easier, and you want to fall asleep all the time, and so it's less productive for work, and so then it increases your risk of heart attacks and strokes and all sorts of health problems.
Right. Is it always with obese people, Jill?
Not always. Actually, there have been young women who are thin that can have sleep apnea. It's all about the structure of the back of the throat and the soft tissue in the palate, and they're collapsing. So while the stereotypical is the big guy with the thick neck, it doesn't have to be.
But if you hear your spouse, female or male spouse, snoring and snorting and then blocking, they're setting up for early death. I mean, hypertension, the strokes, the heart attacks, just a ton of different things that can be. And it isn't always the CPAP that helps them. There's other things like...
Sometimes, there's surgical procedures, dental appliances that can be helpful. And a lot of times people feel better. It's one where you find the problem and they use the solution and they feel better. And
a lot of times they don't know how bad they felt before. They're like, oh, if I had known I was going to feel so much better. They were so exhausted for so long, that was just their life.
I've had cases where you can't talk them into the CPAP no matter what you do. You know how bad it is. They won't wear the darn thing. And then I've had patients who sought it out, found the CPAP machine, used their buddies, found great relief, said, I've got it. I don't need to be tested. I'm going to pay for it anyway. It's just wonderful. Mitchell, do you see a lot of this kind of a problem in the BVI?
Absolutely. I believe that the Western lifestyle, no matter where you actually originate and where you live, I think the pathology seems to be the same, going right through. I think one of the points I wanted to add was the apnea in itself, to be sure that the testing is thorough enough that we differentiate between central apnea versus just obstructive apnea, because again, you want to find the diagnosis and to deliver the correct treatment for those particular patients.
Right, the central apnea is the one where it isn't just the back of the throat that obstructs, it's they don't have the drive from the brain.
Absolutely.
Great, thank you for that. We have a call from Alcester, a lump in the front of the ear that comes and goes, doesn't hurt. What might this be, and should I do anything about it? Jill.
Well, I would say, what's it related to? Is it related to eating? Is it that jaw, that TMJ joint? Is that the lump that they're feeling? Or is it like there's a lymph node there that can swell up if you've had a cold? So is the lump been there the whole time? Was it related to a trauma? Did you poke yourself there, a bug bite, cut yourself shaving? When did it start? Those would be the things that I would try to tease out to figure out, is this related to an infection? Is it related to a tumor? Is it a skin cancer? Is it related to the jaw or a muscle?
Mm-hmm.
So
parotid gland?
Exactly.
Yeah. Anything to add?
I'd say, if you notice it and it goes away in a week or two, more likely to be maybe just a lymph node that from you being sick or a cut. But if it's been lasting for several months, you probably want to get it evaluated.
Yeah.
All right.
As a wise old dermatologist told me, good things come and go, bad things come and grow.
All right. And the last one of those I had was a squamous cell cancer that was from an unknown primary, very treatable. I had another one not too long ago from a lymphoma in that region. And then not just too long ago, I had a calcified little blockage of the parotid gland, this little phlebolith, or not a phlebolith, but a parotid calcification that blocked the flow, and then it was this swelling. There's, as you said though, the list goes on and on. Get it looked at. You have anything to add, Mitchell?
I think that my learned colleagues have covered the basis quite well. I'm just reminded that the adenopathy, if it is adenopathy, we have to be more mindful if we're seeing it bilaterally. and of course, get to the diagnosis of something perhaps more sinister early, and treat that particular condition rather than being just on one side of the neck.
Right, bilateral being both sides. Great. What is the disease called that hardens the lungs and eventually you suffocate to death? A question from Mulbridge. Hardening of the lung. I'm thinking pulmonary fibrosis. What do you? Anything else? Mitchell, hardening of the lungs. What would that?
A very interesting way of characterizing a pulmonary condition. In this part of the world, where the lung doesn't function well and infections of sarcoidosis come very close to mind. But it really depends on where in the world you are. Pretty much so. But again, pulmonary fibrosis is emphysema and those other conditions definitely, help you to really see what the person is really saying. But we need a bit more information on that particular set of symptoms.
Right. Hardening could be from a tumor or from a pneumonia or sarcoidosis, as he said, or tuberculosis, or fibrosis scarring. It goes on and on. It needs an extensive workup. From Sioux Falls, Andrew's aunt wants to know what you think of the opposite doctor on call, the app doctor on call.
Of the app Doctor on Call.
Oh yeah, is there an app?
I'm not aware of that app, Doctor on Call, but
there should be one.
I'll have to look it up.
The app Doctor on Call.
Have you made an app for this show?
Well, no, but you can go to the show and go to oncalltelevision.com, and you can watch it on your iPhone or any of your mobile phones. It can go anywhere. So. What are you thinking?
I know what this is about.
Oh, okay.
I think being able to go on and maybe get antibiotics or get a prescription just from typing in what your symptoms are on one of those deals.
Well, there's a variety of different apps that talk about making the diagnoses. Right. I like medlineplus.gov, which is a really great site. And I'm sure there's going to be more apps that will make people think they don't need a doctor, but what it does is it brings them into the doctor. I mean, it's not gone away.
But if you're getting medication through the internet, through a doctor through the internet, I'd be really wary of that.
Bad. That's bad.
It takes away the relationship with your physician, for one, and two, that hands-on. I mean, I always tell patients if they call me, I can't diagnose you over the phone. I need to see you. I need to examine. I need to take the history as well as use my hands. This is what I was trained to do.
Right.
Use my senses to find what's wrong.
Taking your symptoms and just throwing an antibiotic at it without knowing exactly what's going on, without having a hands-on physical exam could be disastrous.
A bad thing.
I mean, you could go from thinking, oh, it's just tonsillitis to having a tonsil abscess. And that's,
all right. There you go.
Personal experience.
Yes, don't talk about it. Mitchell, 10 seconds. Any other comments about apps?
Apps, the question is really for us, being in a remote jurisdiction, 10 seconds or less, is telemedicine really the future, and are we going to see more of this in the future? Really important.
It'll be interesting. Many of us make resolutions to improve our lifestyle in a healthy direction. Whether you make it on New Year's Eve or your birthday or next Monday, the trick is to find a way to keep that promise to yourself. Our dietitian, Katy VanderWal, is back this week to tell us about strategies that work.
How many of you chose a New Year's resolution that included weight loss, adding more exercise, or even eating healthier? How is that resolution coming along? Have you given up yet? Or are you feeling like maybe if you hang on, you're going to continue to be successful throughout the year? Weight loss is a New Year's resolution that many people choose. And really, if you think about it, it's a very basic concept. The calories we consume throughout the day minus the calories we burn leaves us what we have left. There are many different easy ways to go about losing weight. Eating less. Cutting back on your portions is a simple way to do it. Instead of choosing half cup or 1 cup portions, cut your portions back just slightly to 1/3 cup or even just 3/4 of a cup at your meal times. Eating the right foods is definitely going to be an important thing when working on weight loss. Shop the outsides of the grocery store. Shop the produce section to get your fruits and vegetables. Shop the meat section and shop the dairy section. Avoid a lot of the highly processed foods in the center area of the grocery store. Exercise is definitely going to be an important part of weight loss. You want to make sure you're getting exercise almost up to 30 minutes a day. Start at a small amount if you aren't used to working out that much and work up towards the 30 minutes every day. Goal setting is a great tool to help with weight loss as well. Help yourself out each week by setting a small, measurable, and appropriate goal for yourself to help you stay motivated. If you don't achieve your goal, reset that same goal for the next week and continue to move forward. And also your environment is something that is very important with weight loss. You want to make sure that you set yourself up for success. Get rid of all the junk food at home. Choose to have a healthier environment in your home with your family. Plan activities that include exercise, and just encourage your family in general to make healthier choices. Fad diets can be a part of weight loss, however, you want to really use them with caution. Oftentimes they have promises that can't be kept. If you choose to use a fad diet to help you jumpstart your weight loss, I would use it with caution and also maybe use it under the supervision of your doctor. One last rule of thumb to use is inch by inch, everything's a cinch. When you're working on weight loss, set those small goals, continue to work hard, have a healthy environment, make small changes, and you will be successful.
So let's not be the 8% that's only be the, or the 92% that fail. Let's be the larger percentage that make it by making a reasonable goal and doing it. I would say, though, to goal for weight loss is a very difficult goal. And just make the goal to eat correctly and exercise regularly. Let that be the goal.
But it is a realistic goal.
Some people can.
Yeah.
Some people can. We have a perfect example there. So we've got a lot of questions. I want to start with the man on the street, though, on gout.
On and off over the last 15 years or so, I've experienced some bouts of gout. Just kind of curious about potential diet changes that could help us out on that.
So the question is, special diet for gout. Jill?
Well, gout is the disease of kings, so you have something in common with Henry VIII. It's a disease usually related with red wine, high red meat intake, so those are the sort of things, things that only the rich could afford in days gone by, but now it's become affordable to the masses. So,
Andrew?
Yeah, alcohol in general can make it worse, and meats high in purines, as you were saying. Game meat can kind of sometimes make it worse, or like pheasant. So some people, during pheasant hunting season, that's when they have their gout flare up, especially if they go on a hunting trip and they drink a bunch and eat a bunch of meat.
Yeah. So, anybody down in the British Virgin Islands ever get gout?
Unfortunately, it seems to be in my family. There are lots of big meat eaters. And once we control the ingestion of meat, it's pretty controlled.
All right, so that's an important issue, although I have read, and the counter of that is that it is a much smaller issue. The diet is less of an issue. Hydration is probably a little bit more important. The family history is the controlling part of it, and if you have to, it's good to control it because you'll have recurrent episodes of gout. It is not only destroying the big toe, but it will destroy possibly your kidney with kidney stones. And so it's certainly something to be monitored.
And it can be controlled with medication, too. So.
Yeah, the medicine. Okay, we're going to do rapid fire, kids. Let's go. Right. Quick answers from Canton. Opinion on laser spine surgery. Any opinion on that?
I just caught, surgery isn't always the answer. Back surgery in general doesn't always work. You know, trying some of the other more conservative things first, like physical therapy, is usually more helpful in the end.
Right, and I have to add that use back surgery for pain is entirely unsuccessful. It should be for neurologic deficit and rarely for pain, because it doesn't work well for pain. Here's a Sioux Falls question. 76-year-old woman who had hysterectomy for cancer in 96, had radiation. Could this affect her leg nerves? Jill?
could, especially depending on where the beam was placed for the radiation. You can always get some collateral damage on the surrounding tissues. It could definitely be related to that, but not necessarily. I mean, there's other things that can cause peripheral neuropathy or nerve pains in the legs.
We want to make sure that they've had their B12 and their thyroid tested. Mitchell, yours is the next one. I have a long history of hypertension, but recently I had an irregular heartbeat. Is this a concern, and what causes this?
Well, again, hypertension in itself is one of the major risk factors for cardiovascular disease. So the heart disease is tied with the hypertension. What we need to be sure that we're doing with all of these patients is modifying risk factors, lowering salt intake, controlling blood pressure. Very important. The heart to be much happier.
All right. Aberdeen, what causes temporal arteritis, Andrew?
Well, a lot of times it can just happen, but it's an autoimmune disease, and so it can be just a headache, present as a headache. It can be more common in the Scandinavian population, and thus we do see it around here.
Yeah, and of course, if it isn't treated, people can lose their vision. That's important, so it needs to be aggressively treated. Particular symptoms that people would have, I mean, headache, but what else?
Throbbing headache right by the temple.
Right on the, you can
Right on
feel
the
the lump.
Yep.
All right. Here is from Sioux Falls. After surgery, patient had blood clots and was put on warfarin. One of his doctors says that they should be on blood thinner for life. Another doctor says only 6 months. How do you reconcile the two different opinions? Mitchell, do you have an opinion on how long a person should be on anticoagulation after clots following surgery?
I think the Royal College of Physicians has recently placed a particular note on starting persons on warfarin preferentially when we have so many newer drugs available. But warfarin for the first clot is not lifetime. That is definitely, the research doesn't show that is beneficial.
Jill, any comment?
And especially if you know there was a reason. It wasn't related to a surgery. If it wasn't just a spontaneous clot out of the blue, we know why it happened, then
it's 6 months.
6 months.
But if it's a second time, or it's a third time, or there's a strong family history.
Or they've done the workup for a clotting disorder, and you know that you have this clotting disorder, that's not going to go away, then lifetime would be indicated.
Any comments about the new anticoagulants versus warfarin, Andrew?
They're new, but the nice thing is that they don't require the monitoring like the warfarin. They're more expensive, of course, and they've only been out a few years, so who knows some of the long-term consequences. But they are pretty nice, but they can be hard to reverse too. So
there's a risk there. I've not switched my practice in that direction yet. There's certain patients, though. I wrote an order for one of them this week because of the issues of difficulty in keeping that person anticoagulated. From Brookings, 4-month-old taken to the emergency room for difficulty breathing. He was diagnosed with RSV and sent home. What is his prognosis? Anyone?
So most of the time, you or I might have RSV when we get a cold.
RSV meaning?
Respiratory syncytial virus. And
adults,
so
it's no big deal, but as a kid.
And as a kid, it caused bronchiolitis and inflammation, swelling in the lungs there. And if they're otherwise not in respiratory distress, they can go home and often will recover just fine. But if they're having significant trouble breathing, then they might need oxygen and be in the hospital.
Is RSV a seasonal thing in children?
It tends to be more in the winter months, especially when kids are closed up and indoors a lot. It can run through daycares. That's a bad thing.
And it's really a bad cold, right? I mean, that's what it is. It's just a really bad respiratory coughing thing. Yeah. Mitchell, do you see RSV down there?
RSV in the December to January, those 2 months in particular, we see most of it in the ages between 1 and 6. And that is quite, just be sure we don't give antibiotics for those patients.
Right, we don't give antibiotics for that. It doesn't help anything. There's nothing to do but to just hang on to your hat, right? I mean, anything. So amazing. It isn't related to the cold weather. It's related to the season. They have it down in December and January in the BVI. Yeah. How about that? Hayward in Iowa, a 93-year-old who works out 4 to 5 days per week. Should he maintain this? 93, working out 4 to 5 days a week. I would say, I'm answering that one, Yay! Yes, let's see them do it. Any other comments?
Cars that don't move rust.
Yeah.
People that don't move rust. So keep moving.
Keep moving. That's why he's 93.
Exactly.
When I'm 93, whatever I'm doing, I'm going to keep doing because it's working.
There you go. Here's from Webster. Neural pain in back and feet, hot burning but not diabetic. What can be done other than surgery? So neural pain in back and feet, not diabetic. Question, Andrew.
Okay. Well, you know, nerve pain in general can be pretty tricky. There are certain medications that can be helpful. Diabetes is the leading cause, but obviously there can be other things, B12 like we talked about, folate, and
yeah, I mean, you can treat it with gabapentin or Neurontin, you can treat it with Lyrica. So there are medications that can help. It's sometimes finding the right dose, and a lot of times, especially with these medications, we have to titrate up to the right dose. So I'll have people say, oh, I tried it for 2 weeks, it's not any better. Well, yeah, we're not at the right dose. We have to work our way up there. So don't give up if it doesn't work initially. Sometimes it takes a while to get your system up to the appropriate level.
Right, and I think we probably underuse that very marvelous drug gabapentin. Lyrica is a gabapentin-like drug, maybe a little easier to take, but a lot more expensive. Mitchell, do you have any comment about nerve pain, peripheral neuropathy type of pain?
Peripheral neuropathy pains, I'm kind of curious as to how we arrive at the diagnosis. If the studies were done, nerve conduction studies, or is it just based on physical examination? Because we don't want to miss other pathology, especially in the lower part of the spine. But again, I agree that Lyrica, in particular, pregabalin, excellent for helping to change the whole entire symptomology of these patients. The workup has to be complete, in my mind.
All right, very good. We have from Sioux Falls a son who's got reflex syndrome of dystrophy. Which one? There's a...
Oh, RSD?
Yes, yes. What is that called?
Dystrophy. So that's
Say that again.
Reflexive sympathetic dystrophy.
Sympathetic dystrophy.
Yep.
That's
so
it.
it's a chronic pain cycle where it usually starts out with just a minor injury and the pain doesn't get treated and those pain receptors get triggered and they're basically always on. So your brain is misfiring these pain signals and you end up with this terrible pain from something as simple as the sheets touching your foot. So it doesn't take much for the pain receptors to fire. So they're firing over abnormal, what should be normally not painful stimuli.
It's a tough issue. You want to make sure that there isn't something else going on, and certainly gabapentin would be one of the treatments. Any other thoughts? Mitchell, you have any comment about reflex sympathetic dystrophy? It's misspelled.
I don't have any practical comment on that particular condition. Gabapentin has made us a lifesaver in terms of changing the way patients actually respond to most of the symptoms. But again, the workup for the conditions and how did we arrive at the particular diagnosis. The underlying cause of each condition is particularly of interest to me because patients have symptoms and they arrive at names for symptoms. But again, they may have brought them themselves by looking on the internet.
Yeah.
That's why we should properly.
That's it. They come in with the diagnosis, and then you have to try to crawl through that. We're going to fire through. We're not going to make it all. Alzheimer's. What about it that kills you physically? In other words, I'm sensing this person watched somebody who developed Alzheimer's and then died. Why did they die?
You know, unfortunately, the body can start to shut down, and pretty soon they forget how to eat and even forget how to breathe, and it's quite, you know, can be tragic, obviously.
Oftentimes they inhale their food and they get pneumonia.
Yeah.
Those are terrible scenarios. I think that's it. And oftentimes blood clots because they're not moving, and infections because they get sores because they're not rolling over, and it goes on and on. Clotting, though, is a big part of it, too. Here's on the internet, what are the effects of red meat on your body? Mitchell, do you have a comment about red meat?
I am a vegetarian. I don't want to give my opinions. I don't think that there's any medical evidence
not
that
a vegetarian.
says that red meat is bad. But everything in moderation, I tell all of my patients, moderation.
Moderation, there you go. But he is a vegetarian. Any comments about red meat here? We're, of course, a red meat state, and we want to say good things about red meat because go beef, right? And so I think in moderation, the comment I would say is we're finding more and more carbohydrate is the bad comment or the bad actor in our diets more and more.
Yeah, there's a study, the A to Z diet, that compared several different diets, and in that instance, the Atkins diet was the most successful at losing weight. Some other studies since then have shown that it looks like the people that have insulin resistance and insulin sensitivity respond the best to limiting carbohydrates.
Right. Okay. And any comment, fats comment? We're just about out.
Oh, steaks are tasty. So.
Okay, steaks are tasty.
But know what a serving portion is. A deck of cards, that's a
deck
serving
of cards.
portion. Not the plate that, you know,
right.
the steak that fills the entire plate. That's like 4 portions.
We'll be back right after this.
With 2013 behind us, our thoughts turn to romance. That's right. We're entering a time of year symbolized by none other than the flu bug. Did you know flu season usually doesn't peak until February, sometimes even later? Why take chances? It's not too late to get vaccinated, because stopping the flu starts with you.
Listening carefully, I mean really listening, is the most important diagnostic tool in the doctor's bag, but it's rarely straightforward. It's that pesky ulcer again, she said. Just prescribe me more of that heartburn drug and I'll be better. But the pain progressed. The after a fatty meal and recurrent nature of the pain story came out. With the added character of the exam and an ultrasound test, the diagnosis of gallbladder disease finally was made. Soon after, we removed the infected and almost ruptured gallbladder. I have sinusitis and bronchitis and need an antibiotic. Nothing helps me until I get the antibiotic. Just give me the antibiotic, he demanded. And yet, after learning of the 2 days of sore throat and ache all over, and then the runny nose and 2 weeks of a cough, it was clear he had a viral infection, which in turn triggered some asthma bronchitis-like problems. What he needed was inhaled steroid asthma medicines and some time for the viral illness to run its course. That given, the correct treatment was provided, the coughing resolved, and an exposure to a dangerous antibiotic was avoided. There's been blood in the toilet again, but it's just my hemorrhoids, he said. It took some convincing to get him in for that colonoscopy, but when we did, there was this large polyp turning to cancer out on a stalk in his colon, which was removed through the scope. Not what he expected, but his story brought us to save him from cancer death. With all these misleading words, still the patient's story and the clinician's ear are the most important diagnostic tools available. In this time of advanced technology, extensive blood and laboratory tests, complex genomics, and MRI, CAT scan, and PET scans, the old-fashioned taking of a careful history is still the most important way to make the correct diagnosis. More than one research study has shown that laboratory and imaging tests make the diagnosis about 5% of the time, the physical exam about 15%, and the history about 80%. Of course, it's important to use the right test when appropriate, but in this day and age, some would criticize modern medical providers for becoming too dependent on fancy and expensive tests and for not taking enough time to listen, I mean really listen, to what our patients have to say.
I say everybody's got to have their day, and don't you know that everybody's got to love somebody sometimes?
I sincerely thank our guests, Dr. Kruse, Dr. Ellsworth, and Dr. Penn, for helping to answer all the questions from our audience tonight. Great questions, and you could be watching the Olympics, but you were watching tonight. Each week, we look forward to the questions from you and our audience partners. Unfortunately, we're often out of time at the end of the show to answer all of them. To improve on this, though, Off the air, we will record answers to many of those questions. To view these, just visit our website, oncalltelevision.com, and click on Archive button for answers to the questions we couldn't fit into this evening's show, and we got a bunch of them. It may take a day or two to get them posted, but your questions are important to us, and we don't want to leave them unanswered. This brings us to the end of our show this evening. Since this program focused on questions, we found that the political philosopher John Locke noted, "There is frequently more to be learned from the unexpected questions of a child than the discourses of men." Until next time, stay healthy out there, people.
Funding for On-Call Television is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On-Call Television as it continues to open doors for important medical information.
and by the South Dakota Foundation for Medical Care, the quality medical improvement organization for South Dakota. Additional funding is provided by Dakota Care, Brookings Health System, Dakota Allergy and Asthma, Dakota Dermatology, Aberdeen Asthma and Allergy, Orthopedic Institute, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation.